Hi everyone. In this short video, I'm going to talk about how to give a family-centred parent update in the special care nursery. I chose this topic because family-centred care is a really important part of neonatal nursing and midwifery, but it's not always carried out consistently in everyday practice. In the teaching program I developed, feedback from families showed concerns around inconsistent communication, limited involvement, and not always feeling included in decisions. So this video focuses on one practical skill staff can use straight away: making parent updates more family-centred. In the special care nursery, parents are often stressed, overwhelmed, and trying to understand a lot of new information while also coping emotionally. A routine update might only take a minute or two, but the way it's delivered can make a huge difference. A good update can help parents feel informed, respected, and involved. A poor one can leave them feeling confused or left out. Family-centred care is really about partnership. It means recognising that parents aren't just visitors, they're an important part of their baby's care. So when we're giving an update, we're not just passing on information. We should also be using plain language, inviting questions, checking understanding, and involving parents in what happens next where possible. I'll show you what that can look like with a quick example. Here's a common kind of update that might happen in practice.
Sally, I'm Brianna. I'm looking after baby Noah today. Just giving you an update. So he's been really stable overnight. He tolerated his feeds. We weighed him overnight. He gained 70 grams, which is great. We'll do the ward round and then we'll just make a plan for hopefully some more suck feeding today.
Okay, so now clinically that's fine, but from a parent's perspective it may not be very clear. There's quite a bit of medical language in there, things like tolerated feeds, observations, management plan, suck feeds, and there's no check that the parent actually understands what's being said. It also doesn't invite the parent into the conversation. All right, now let's look at a more family-centred version.
Hi Sally, I'm Brianna. I'm the nurse who'll be helping you guys today. Just wanted to give you an update on Noah and see how you're going as well. So overnight he's had a really good night. He's managed his feeds really well. All his breathing, heart rate, temperature have all been within normal ranges. He's due to be weighed today, so I thought we could do that together.
Yeah.
And the team's coming in and we'll do a ward round soon. Then we can discuss your long-term and short-term feeding plans.
Sounds good. Do you think he'd be able to go home? It's sounding really positive.
Yeah, it's really positive. He's looking really good. We'll see what they say on the ward round. Did you have any other questions for me at the moment?
I'm not really sure about suck feeding. What does that mean?
Yeah, so that can be breastfeeding, bottle feeding, or a combination of both, whatever he's ready for and whatever you're comfortable with as well. So just to, so we can talk through the options before we make a plan around that as well.
Okay.
So just so I know that I've explained that clearly, can you just tell me in your own words what the plan is for today?
Yep, so I think he's due to have a weight today, and we'll do that together, and then he'll be reviewed with the ward round, and then we can make a feeding plan.
Yeah, that's great. All right.
Thank you.
No worries.
Okay, so what made that version better? So the nurse used plain language instead of assuming the parent knew what stable meant, and they explained it simply. The nurse used open the conversation in a warm way by asking how the parent was going, not just launching straight into the clinical information. And she used language that was inclusive. I'm the nurse who will be helping you, as opposed to I'll be looking after your baby, which implies that the parent is a bystander. They also invited questions, which gives the parent permission to speak up. And they involve the parent in the daily plan, i.e. weighing the baby. And then finally they use teach back, So they ask the parent to explain the plan in their own words, and that's really useful because it checks the understanding in a respectful way. It's not about testing the parent, it's about checking whether we have explained things clearly. So to wrap up, a family-centred parent update doesn't need to be long or complicated. Even small changes can make a big difference. So try to remember these 3 things. Keep it clear, invite the parent and include them in the daily plan, check their understanding, and by doing that, we move away from just giving information to actually building partnership with families, and that's at the heart of family-centred care. As a follow-up to this, I will be auditing some staff-parent interactions and grading them using a checklist. I will then provide a one-on-one feedback session.